Have you ever felt like your mind and body were both tired at the same time? Maybe you feel foggy, emotionally drained, irritable, anxious, or just low, and you keep telling yourself, I need to get it together. But what does that look like? What if your mental health is not only about your thoughts? What if your body is also trying to tell you something? Well, today we're talking about inflammation and mental health. What inflammation is, what can contribute to it, and how it may show up both emotionally and mentally, and what you can do to begin supporting your body and your mind in a balanced way. Before we go any further, I want to be clear. This recording is for educational purposes only. It is not a diagnosis, and it is not a substitute for medical or mental health care. So, what is inflammation? Inflammation is part of the body's natural defense system. So when you're injured or sick, inflammation helps your body respond and heal. It's that kind of short-term inflammation that's necessary. The concern is when inflammation becomes more chronic, when the body stays in a stressed or activated state over time. As this relates to mental health, chronic inflammation can be connected to several factors. One is chronic stress. When you're under constant pressure, your stress response can stay turned on. Over time, that can affect the body's hormones, your immune response, your sleep, your digestion, so many things, your mood, your motivation, focus. Another factor is poor sleep. Sleep is when the body restores, repairs, and regulates. Lack of sleep or disrupted sleep can make stress and mood harder to manage. Your food patterns can also play a role. This doesn't mean you need to eat perfectly, but a pattern that is high in ultra processed foods, added sugars, refined grains, and low in fiber rich foods can also contribute to inflammation. On the other hand, whole foods like fruits, vegetables, legumes, whole grains, nuts, seeds, olive oil, omega 3 rich foods, all of those can help support a more anti inflammatory eating pattern. Inflammation can also be related to chronic health conditions, pain, autoimmune disease, diabetes, hypothyroidism, and other medical concerns, which is one reason why getting a physical is so important. It really matters. In fact, chronic disease and depression can actually worsen one another, and depression itself may be connected with changes in inflammation, stress hormones, and circulation. So let's look at how this might actually show up emotionally or mentally. For some people, it might look like brain fog. So this could be difficulty concentrating. You might have a feeling of feeling slowed down, low energy, irritable, low mood, anxiety, sleep changes, feeling less motivated. You might also feel like small tasks take more effort than they used to. Now, again, please remember these symptoms don't automatically mean inflammation is the cause, but they are signs worth paying attention to, especially if they're persistent, new, or interfering with your life. So, what can you do? The goal is not to panic or self diagnose yourself, and you don't have to overhaul your entire way of doing things overnight. Right now, your goal is just to begin listening to your body with curiosity instead of shame or pressure. So, here's one step that you can put into practice right away. At your next meal, just pause and ask yourself, can I add one thing that supports my body instead of focusing only on what I should remove? And you choose an add on. You can add a colorful fruit, add a vegetable, add a fiber rich food like beans or lentils or oats or whole grains. Add a healthy fat like olive oil or avocado, your nuts or your seeds. Or add one omega-3 option like salmon, sardines, tuna, walnuts, flaxseed, or chia seeds. Then, after you eat, check in with yourself 2 hours later and simply notice, how's my energy level? How's my mood? How clear or foggy do I feel? How steady do I feel? And you're not doing this to obsess over your food. You're doing this just to build your mind-body awareness. A lot of people try to change their health from a space of criticism, but healing habits tend to last longer when they come from care, not punishment. You want to tell yourself, I am learning what helps my body feel supported. So focus on what you're going to do instead of what you're not going to do. You can also pair this with one small lifestyle support, like a 10-minute walk, a consistent bedtime wind down time, limiting your alcohol intake, reducing your sugar where you can, um, or even scheduling those doctor's appointments that you've been putting off. And if you're dealing with ongoing symptoms, please bring a written list to your doctor. That way you don't have to try to remember things off the fly and get lost and say, oh, I forgot about this. You'll have everything right in front of you. Include your mood symptoms, your sleep, your energy levels, any pains you're feeling, any digestive concerns, menstrual concerns, menopause, perimenopause changes, anything like that. Any medications you're taking, any supplements, anything that just feels different in your body. These are the things that you want to note and bring to your doctor. That kind of information can help your provider better decide what to assess. And of course, if you're leaning into your faith, this is where you have to remember that our bodies matter. Caring for your body is stewardship. If we look at Psalm 139, it reminds us that we are fearfully and wonderfully made. That includes the connection between your mind, body, and spirit. So pay attention to what your body needs. Paying attention to your body is a way of honoring how God created you. And I want to remind you that you don't have to choose between prayer and practical care. You can pray, seek wisdom, make the appointment, talk to the professional, nourish your body, and give yourself permission to receive support. Even praying about what the professional is telling you, praying for guidance. What does the Bible tell me about that? Go back to the Bible, talk to the Lord, and proceed according to what God is leading you to do. This way, you're practicing stewardship and you're going about it with wisdom. So this week, try adding one supportive food to your meals. Check in with your energy level, your mood, your clarity later on, about 2 hours later, and lean into your curiosity, not your judgment. And if your symptoms have been ongoing, make a doctor's appointment. Get the physical, ask your questions, and advocate for your care, because your mental health matters and your body needs to be part of that conversation as well. Until we meet again, remember to fill your cup first and then pour into others. If this message encouraged you, be sure to subscribe so you don't miss future episodes. And of course, share it with someone who could use a little encouragement today. Hi, I'm Crystal Hawkins, a licensed professional counselor and licensed clinical alcohol and drug counselor. Thank you for listening.